Homeless people die younger and cost the NHS much more to treat them than the general population. And after years of decline, homelessness is once more on the increase. So the UK's first international conference on homeless health, which has been taking place this week, is well timed. Our reporter Paul Waters has been speaking to the delegates, beginning with Harriet Mitchell and Jerry Dixon, who were themselves homeless.
I was actually homeless for 5 years. My local borough didn't want to know me until I actually collapsed in the middle of the street and I had to be hospitalised.
On the first night, when I had to check into the night shelter, I had my own prejudged opinions of homeless people. So I was pretty worried about my staff and my safety. But then over the months, obviously I got to know everyone, and homeless people are people too, and I was part of the community.
Probably we're more important than the top people who are speaking, because we have lived it and we are here trying to give them our experience and hopefully show them the way.
According to Crisis, the homelessness charity, the average death for a rough sleeper is 47 compared to 77 for the rest of us. And the most recent Deloitte report on homeless healthcare says homeless people attend A&E 6 times as much as the general population, are admitted 4 times as much, and stay in 3 times as long. So why are homeless people so difficult to treat? Alex Bax is the chief executive of London Pathway, which is one of the organisers of this conference.
What's commonly said is it's because they're hard to reach, but they're not really hard to reach. They present in hospitals frequently, more than many other patients. They're hard to treat often because they've got a whole set of issues in their lives. Homelessness, obviously, but a set of health problems compounding their homelessness. And that makes them difficult because different health conditions, there's a layering effect. One adds and makes treating the other more complicated. And many patients will have a mental health issue, many patients will have an alcohol or a drug issue, and they'll have perhaps diabetes or a chronic physical condition, and then they'll have a crisis which has brought them into hospital.
Alex Bax. Healthcare is about compassion, but it also costs. Treating homeless people has worse outcomes compared to the general population and costs up to 8 times more. So, leaving compassion out of it, let's talk about money and how to save it. Barry McCormick used to be the chief economist for the health service in England.
If we fail to, as we often do, identify people vulnerable to homelessness at an early stage and allow a long period of homelessness to occur, their condition can often worsen, and this means that the cost to the system, not only in terms of health but social care, support, housing. So it makes sense from the taxpayer's point of view to strike early and bring an end wherever it's economically efficient to do so, bearing in mind those long-term costs. Well, if, for example, our preventative policies towards homelessness were tightened up, those patients would require shorter spells in hospital, and that would directly reduce costs. I think the bigger picture, though, is much more startling. It extends to the higher levels of care support, the higher levels of housing need. Homeless people usually don't just disappear and die in their 40s, but mostly they'll live on into their 60s and require support.
The conference is about sharing new ideas, which is why there are so many foreign delegates, like Dr. Jim O'Connell, president of the Boston Healthcare for the Homeless program.
I think what we have learned is that for a population that's as excluded as people living on the streets and homeless folks, they are so desperately trying to get to the next meal or a safe place to sleep that going to healthcare or thinking about healthcare is a very, very low priority. So if we're going to expect to do preventive and do good care, we're going to have to get our doctors and our nurses and our teams out of the hospitals and out of the clinics and out of the GP offices and out into the streets and the shelters to see them where they are. The rule at home is if you wait for them to come to you, you've already lost.
The NHS is going through major change at the moment. Experts agree that healthcare provision for homeless people should change. But will it? Professor Steve Field is a GP. He's also National Deputy Medical Director for the NHS in England. You have described some of the healthcare provision for homeless people as a disgrace.
I've had the privilege of going around England over the last 2 years. I've seen some wonderful general practice and hospital care, but at every meeting I've been been to, I've also met patient service users who've been either turned away from a general practice or treated appallingly in some of our emergency rooms in our hospitals. This conference is a fantastic opportunity. There are people here from the York Street medical practice in Leeds and Luther Street in Oxford. London Pathway is extraordinary. They involve homeless people, getting them back into work. There's a GP and a nurse practitioner working in the hospital, and what they've done is whenever a patient goes to University College London into the emergency room, they are looked after, and there's a diagnosis which doesn't include health on its own. It's housing and social care. They've shown that they can save a couple of £100,000 a year, but more importantly, they can help the people not be in hospital for as long as others, discharge them into safe accommodation, and their health outcomes are improved. My job will be to help make sure that people know where the good practice is so that they can do it in Birmingham or Nottingham or Leicester or elsewhere.
Usually the experts have the last word, but the official review of this conference is being put together by service users, i.e. formerly homeless people. So what's their verdict so far?
My verdict so far is there's been 2 speakers who actually do understand homelessness, and they've spoken with a compassion, and they genuinely care about what is happening to people on the streets and how they can solve that problem. The rest of them, to me, have just waffled on like people have been waffling on in this service for the last 5 years that I've been involved in it.
I didn't realise there were so many healthcare professionals that want to make a difference. I'm optimistic for the future of homeless people.
Harriet Mitchell and Jerry Dixon ending Paul Waters' report.